In this video of influential breathwork, we are talking about the risks associated with breathwork that I believe you need to know before you dive into this incredible world of a transformational tool that can impact your physical, mental, emotional, mental health. Did I say mental health? Whatever. We won't worry too much about that. This can change everything for you. Your spiritual health, that was the word I was looking for. And there are some risks involved. And I don't want to scare you by talking about the risks. What I want is to get you excited about the possibilities. But you've got to do this in a knowledgeable way. So this is a little intro to some of the risks. By no means is it comprehensive. This is not medical advice, but hopefully it will show you the power of breathwork and why this is an incredible modality that you want to bring into your life. So the reason that we have to be really aware of the risks is because there are lots of contraindications as to what you must not already have before you do particular types of breath work. Because it's not uncommon for people to have strong reactions to breath work. Now, we often refer to them as abreactions. And these are things where people have very, very strong experiences that can affect them mentally, can affect them physically as well. So let's start with the mental stuff. So if you have had any form of schizophrenia or bipolar, then you need to have checked with your doctor that you are allowed to do breath work. Okay, you want to get their go ahead, and also what kinds of breath work, because this is such a burgeoning field, a growing field, and there are polarities within breath as well. So it may be okay that you do some calming, deep diaphragmatic breaths. You might be okay to do some of the functional breathes, but you might not be okay to do some of the longer breathwork journeys. And you do want to make sure you get medical advice on that. Or if you're doing a recording online, for example, ones that we have in the Influential Breathwork portal, you want to know whether it is safe for you to do that, because ultimately you have the personal responsibility. You also want to consider if you have been having a lot of anxiety or panic attacks. Now, if that is the case, you may well, again, be great to do the breathing exercises that bring you calm and bring you down, but you might not be ready to do a really heightened breathwork journey, okay? Because if you're already really, really stressed and your sympathetic nervous system is activated, it's not necessarily the right time for you then to do a long conscious connected breathwork style, for example. So then we come on to, and again, in terms of, so then we come on to if you are going through an intense period of trauma right now, it would be great for you to be able to center yourself and bring that activated stress symptom back down. But it may not be the most appropriate time for you to do one of those longer breaths. And again, this is an area where you have to make that judgment call. And I would say that really does depend on how experienced you are as a breather as well. Looking at the other end of the scale, looking on the physical side of some of the risks in doing breath work, you want to make sure that you aren't doing breath work if you have any extremes of blood pressure or any cardiovascular issues, again, without your doctor's permission. And most of the time, if those things are medicated, particularly blood pressure, if blood pressure is medicated, you are probably okay. You want to just check with your medical professional first. So lots of things going on with the heart, because as we're increasing the respiratory rate, as we're increasing our breathing, we're activating our body. And these can be incredibly good for heart health, but you've got to make sure that you are in a place where your physicians are comfortable with you doing it. The other thing then is if you've had any type of surgery, and this is particularly true if you've had any abdominal surgery or you've had something around your eyes or your head, because we are really activating blood flow. So you've got to make sure that those wounds, those that have healed, the place where you've had surgery has begun to heal properly. and that it is appropriate for you to be doing a deep breathe. So be aware of that. And this also applies eye surgery, particularly because we can actually put a lot of pressure in our heads through doing these breath works. And that applies also anyone who has glaucoma. You've got to be really careful with your breathes. And then we've got to mention pregnancy. So some people who are very experienced breath workers, they may be okay to breathe because they know what they're doing and they know their bodies. However, there is a risk at every step along the way in pregnancy. There are certain breathwork exercises that should never be done by someone pregnant, because again, you're changing the biochemistry in your body, you're changing the pH balance in your blood, and also you're putting your body under a deliberate stress for a short space of time. So if you're pregnant, I would advise you to just lay off the breath work. Maybe just give yourself that 9-month period to go back to doing meditation or something else that helps you relax, but lay off the breathing exercises. And then we've got to mention that there are all sorts of things that can happen for you when you do breathwork journeys, particularly. And the reason that I think it's important for you to be aware is that there are all sorts of experiences that happen that could be physical. So it might be that you become a little bit dizzy or you feel a bit sick. Some people actually can actually end up vomiting. It's very rare, but it can happen. You may have tingles, or you may have what's known as tetany, which is a little bit like having, I would say they're like T-Rex hands, where your hands kind of get a little bit stuck, or sometimes your feet as well. And this is a really normal reaction to the change in the chemistry balance in your blood, but it feels quite unusual. So if you don't like those symptoms, then just lay off the heaviness or the depth of the breathe that you're doing. It's normal. It's because of the chemical exchange. It's part of the factory reset that you're putting your body through. But if you don't like it, you're always in control. It may be that as a result of doing breath work, you have some traumatic memory that comes to the surface. And the reason for that is that we store trauma in our body, in our tissue, in our cells, in our fascia. It's locked away. But actually, by having it there, it's actually causing us to have patterns and limitations in our life that actually aren't good for us. Whilst locking that away might have protected us in the short term, it's not good long term. So it may be that you have a memory come up that's really uncomfortable for you. But what's incredible about any type of somatic therapy, including breathwork, is that when you feel into that emotion, when you let it be there, and very often it will pass through you and out of you, and your body can process it in a more normal way, which wasn't possible at the time that initial trauma happened. But just be aware that those things can happen. Breathwork is super powerful for all types of holistic healing. Like, we have this key ingredient that we don't know how to use most of the time. And that's one of the reasons why I'm really passionate about getting this information out about how to breathe. And I do think it's important that we are aware. Now, this is not a comprehensive list, but just to recap, anything where you have extremes of mental health imbalances. So, for example, maybe you've had psychotic or schizophrenic episodes in the past, check with your doctor. If you are going through a really heightened period of anxiety, just stick with the diaphragmatic slow breathing. Don't yet lean into those long journeys. They will be good for you when you've just got yourself a little bit calmer. If you have any extremes of blood pressure, it's not for you right now unless it's medicated and you have doctor's permission. Same with any cardio health issues, or if you have a pacemaker, for example, check with your medical professional. And also any type of pregnancy. So wherever you are in that pregnancy journey, and if you've had any surgery or eye issues, particularly glaucoma, lay off the breath work, really lean into meditation, lean into those calming breaths, but stay off the more stressful types. I hope that's been interesting. And if you're enjoying this channel, I would love you to hit subscribe and follow wherever you are listening today. Comment below if you did not know about any of these pieces of risk associated with breathwork.